Anxiety disorders. General anxiety disorder. Individuals with GAD experience persistent and uncontrollable worry about various aspects of their life, such as work, relationships, or health. People with GAD tend to overthink situations, imagining worst-case scenarios, making it hard for them to relax. Panic disorder. Panic disorder is characterized by unexpected and intense episodes of fear or panic, often accompanied by physical symptoms like a heart racing, sweating, and shortness of breath, also known as a panic attack. Social anxiety disorder. SAD involves an intense fear of being judged, embarrassed, or humiliated in social situations. Individuals with social anxiety may avoid social gatherings, public speaking, or other situations where they feel exposed. Specific phobia. Specific phobias involves an irrational and overwhelming fear of a particular object or situation. An exposure to the phobia triggers an immediate anxiety response, often leading to panic attacks. Obsessive-Compulsive Disorder. Individuals with OCD experience unwanted and distressing thoughts or images that repeatedly enter their mind. To alleviate anxiety, individuals engage in repetitive behaviors or mental acts, such as washing, counting, or checking. People with OCD are often aware that their obsessions and compulsions are irrational, but feel compelled to perform them anyway. Post-traumatic stress disorder. PTSD can develop after exposure to a traumatic event, such as combat, natural disasters, or personal assault. Individuals with PTSD may experience flashbacks, nightmares, or intrusive memories of the traumatic event. Agoraphobia. Agoraphobia involves a fear of situations where escape may be difficult or help unavailable, leading to avoidance of public places. Individuals with agoraphobia may avoid crowded spaces, public transportation, or leaving home altogether. Depressive disorders. Major depressive disorder. MDD involves persistent and pervasive feelings of sadness or a lack of interest in activities. Symptoms must be present for at least 2 weeks to be diagnosed with MDD. MDD can manifest physically, leading to changes in appetite, sleep disturbances, and fatigue. Persistent depressive disorder. PDD involves long-term chronic low moods that last for at least 2 years. While the symptoms are less severe than major depressive disorder, they are persistent and can affect daily life. People with this often have periods of feeling better, but overall the low mood persists, and often this begins in adolescence or early childhood. Bipolar disorders. Bipolar disorder involves episodes of mania and depression. Type 1 involves manic episodes that may include risky behavior or impaired judgment, while Type 2 involves hypomanic episodes and depressive episodes. Seasonal affective disorder. SAD is characterized by depressive episodes that occur seasonally, often in fall or winter. Lack of sunlight exposure is thought to contribute to the development of SAD. Individuals may experience increased sleep and appetite during depressive episodes. Light therapy or exposure to bright artificial lights is a common treatment, and symptoms often improve in the summer and spring. Premenstrual dysphoric disorder. PMDD involves severe mood changes in the luteal phase of the menstrual cycle. Symptoms can include irritability, sadness, and physical discomfort. PMDD can strain relationships due to the intensity of the mood changes, and symptoms occur in the week or two before menstruation and improve shortly after. Atypical depression. Atypical depression is characterized by mood reactivity, where individuals can experience temporary improvements in mood in response to positive events. Unlike typical depression, atypical depression may involve increased appetite and excessive sleep. Individuals may be particularly sensitive to interpersonal rejection, and atypical depression may have a chronic course with persistent symptoms. Psychotic depression. Psychotic depression involves the presence of psychotic symptoms, such as hallucinations or delusions alongside depressive symptoms. Individuals with psychotic depression may be at an increased risk of self-harm or in severe cases, hospitalization may be necessary for safety and treatment, which often involves a combination of antidepressants and antipsychotic medications. Disruptive mood dysregulation disorder. DMDD is diagnosed in children and adolescents who exhibit severe and persistent irritability and frequent temper outbursts. Symptoms must begin before the age of 10, and the mood state is consistently irritable rather than episodic. Postpartum depression. Postpartum depression occurs after giving birth, and it's not just baby blues, which are milder and short-lived. Symptoms will include sadness, fatigue, changes in sleep and appetite, and difficulty bonding with the baby. Situational depression. Situational depression, or adjustment disorder with depressed mood, occurs in a response to a specific stressor or life event. Symptoms develop within 3 months of the stressor and are out of proportion to the situation. The condition is typically time-limited, with symptoms diminishing as the individual adjusts to the situation. And if you enjoyed this video, make sure to subscribe and let me know what you want me to explain next.